Hi, my name is Joey Frankine, student physical therapist, University of St. Augustine. What's your name?
Hello, I am Rodney Rump.
Rodney Rump, huh? How old are you, Rodney?
72 years young, my good man.
Okay, 72, male. What's going on?
I've had some pain.
Okay.
On the right side of my bottom and my leg.
Okay, on the right side of your bottom and your leg. Okay, sorry, I have a dog here that's getting in the way. Okay, of your bottom and your leg. Okay, does it go past your knee into your calf and your foot?
Sure does. It goes in my calf.
Okay. How do you explain your pain? Is it like a burning, tingling numbness, or is it like a sharp, dull pain?
Tingling.
Is it burning and numb as well, or just tingling?
Just tingling.
Okay. And if you were to grade your pain, 1 is just barely there, 10 is so bad that you have to go to the hospital. How would you grade your pain?
Right now?
Right now, yeah. Sitting
6.
Here. 6.
Mm-hmm.
Okay, and then how would you grade it at its worst?
Probably an 8.
An 8, and then at its best?
A 3.
What makes it worse?
When I stand on the leg.
How long?
Well, specifically if I'm standing and I'm leaning backward, or if I have to bend forward, if I have to lift anything.
So if you're standing, leaning backwards.
Yep.
If you have to lift anything.
If I'm bending forward. So leaning backward, bending forward, lifting, and walking, whether it's I'm on level ground or on stairs.
So do you have any issues with stairs? You said you have, so is that what essentially you're saying? You have difficulty ascending and descending stairs? Okay.
Mm-hmm. And I'm having a hard time just standing on the leg.
Okay. How long can you stand until you have issues? You don't know? Okay. What was there, like a certain incident that happened, like a certain injury that this happened, or did it just kind of happen over time? Over time?
Mm-hmm.
Okay. Has it gotten better, worse, or the same since this happened? How long ago did it happen? I guess I should ask you first.
3 months ago.
3 months ago. All right. So then, since the past 3 months, has it gotten better, worse, or the same?
Stayed the same.
Same. Just for 3 months. You're just now seeing me, huh? Is there any warmth or swelling?
No.
Okay, and you said there's tingling, but no burning or numbness.
Correct.
Are you feeling any sharp pain, like in your back or in your legs at all? Or?
Nope.
No.
It's I guess I would say it's deep burning and aching.
So there is some burning.
I guess so.
Deep. Where is this deep burning and aching?
It's just there.
Okay. Is this in the leg, in the back? Okay. Do you have any previous history of this issue?
No.
Do you have you taken any medication for this at all?
No. Nope.
Do you take any medication for anything else?
Yeah.
What's that? What do you take? And what is it for?
I have high blood pressure, and I have diverticulitis.
High blood pressure and diverticulitis. Okay. And you take medication for both?
Correct.
But no pain for this. Or no, I'm sorry, no medication for this.
Correct.
Okay. Have you had any past medical history, like surgeries for your back or for your legs at all?
I don't think so.
Okay. Do you have any night pains or any gastrointestinal issues or any fever or any history of cancer for either you or your family?
I do have gastrointestinal issues because I have diverticulitis.
Okay, so besides that,
Nope.
okay. Do you have any unexplained weight loss or weight gain recently?
No.
Okay. Let's see. Have you gone to the doctor?
I have.
And what did the doctor have to say?
We did x-rays and an MRI, and I have multiple level facet joint arthrosis and stenosis.
Multiple level.
Facet joint arthrosis and stenosis.
Did they say where?
Sure didn't.
Okay. Tell me about. Tell me about like some hobbies. What do you do for fun?
I like to go bowling and shooting at the gun range.
Okay.
I
Is there
also
anything
like
else?
to do yard work.
Okay. How is this affecting you able to do those things?
Well, I'm not able to do my yard work. I had to pay a company to come out and do that.
Okay.
And I haven't been able to go to the gun range.
So you haven't been able to do any of these things due to pain. Okay. Before, I mean, I guess I should ask you, do you have any, are you employed currently? I know you're 72. Are you retired at this point?
Mm-hmm.
Okay. So before this, you were able to bowl and shoot at the gun range and do yard work pain-free. Am I understanding that correctly?
Correct.
So how is this affecting your home life at all? Like putting on pants, clothes, anything like that?
Well,
You said ascending stairs is difficult.
yeah, my bedroom is upstairs, so it's really hard.
Okay. Let's see, what else? What are your goals for physical therapy?
I would like to be able to do my yard work and do my hobbies and not be painful.
All right. So I'm gonna restate the everything I found, and let me know if I missed anything. So you're having some back pain 3 months ago. Kind of, you don't know when. You just kind of happened gradually.
I would not call it back pain.
So you're just feeling it down into your legs. That's it.
My right butt and my right calf.
Okay. Right butt and calf. All right. So this happened 3 months ago. It's a deep burning and aching. You have high blood pressure, diverticulitis. That's managed by medications. So the doctor, they said you have multiple level facet joint arthrosis and stenosis, and that you like to bowl and shoot and do yard work, but you're unable to do the pain.
Yeah, remember when I said I had tingling?
Yeah.
That's been there for about 4 weeks.
Okay. So the tingling is new,
Yeah,
but the burning and aching is not new.
correct. Sorry, I also have a really bad memory because I'm 72. So.
Okay. Okay. Is there anything else that you'd like to tell me?
Do you want to know what makes it feel more comfortable?
I would like to know that. Yes. What makes it feel better?
When I lay on my back and I have my knees propped up on 4 pillows, or if I lie on my side in the fetal position.
Okay.
That's about it.
All right. All right. We'll stop it there. So my hypothesis is that clearly you have multiple low facet joint arthrosis and stenosis, and the facet space is compressed and leading to a compression of the nerve root. So I'm going to say it's radiculopathy due to the imaging and due to the symptoms that you are experiencing with the tingling, burning, and aching into your legs and down into your calf that is going past the knee. So I'm going to call that, I'm going to go with lumbar radiculopathy. The exam steps I would like to perform are like to do structural inspection, active range of motion, passive intervertebral motion (PIVM), and I'd like to do neuromuscular assessment as well for dermatomes, myotomes, reflexes, and slump test. All right, so I'm going to do a structural inspection first. So I'm going to have your legs at the table, please. And review your posture, any muscle tone or increased shifting from the front, from the side, from the back, and from the other side. So I'll be observing for any lateral shifts, any increased light lordosis, increased kyphosis, increased cervical lordosis, anything, any increased tone in the musculature in the back or around your shoulders, forehead posture. So I guess I'd ask you, what's the findings for structural inspection?
Oh, sorry. Forward flexed posture at the hips.
Forward flex at the hips. Okay.
10 degrees. Increased lumbar lordosis.
Increased lumbar lordosis. Okay. So I would also have you stand up and do it as well. That's how I would figure out the hips. So you'd be slightly bent at the hips. So again, I'd say from the left, from the front, have you from the right. Sorry, your left, and then also from the back. So they're saying increased lumbar lordosis and forward flex at the hips by 10 degrees. Okay, so then I'm going to move on to active range of motion. So maybe stand up again. Maybe just move a little bit in front of me here. Okay, so I'm just going to kind of stabilize at your pelvis here at the bilateral iliac crest. I'm going to have you move into flexion. So I'm going to have you bend down and you tuck your chin and then bend down. Okay, come back up. I'm going to have you rotate to the left. Okay, now rotate to the right. Good. I'm going to have you bend backwards. Maybe put your hands on your hips, and then have you just kind of lean back. Okay, and I'd be asking if this, you go back up, I'd be asking if this causes any pain to the patient at all during this time. Then I'd have you put your hands down to your side, and then I have you lean to the left, so sort of like you're trying to touch the floor with your hand. Okay, then lean to the right. Great. All right, come back up. No problem. So then I'd be asking if this, again, I'd be asking if this causes any pain to the patient. I'd be observing for any decreased range of motion or lack of consistency from left to right. So can you tell me, actually, before I even do that, I'm going to have you stand up. I'm going to have you kind of just bring your hips up, kind of like march a little bit. Good. Okay. And then can you kind of kick your leg out, both sides. Okay, then kind of kick back. Good. Can you sit down on the table, please? And then bring your leg up, please. All right. So provide some pressure. Resist that for me. We've done the left side now. Good. And have you kick out with this leg. Good. Kick out with this leg. And kind of then bring your leg back. Bring your leg back. Excellent. Then have you push this leg out like that. Good. Now have you push this leg out like that too. Now bring it in. Excellent. Bring this in. Perfect. Okay. So I'm going to okay, so then if you could give me the active range of motion examination
Alright,
findings.
reflection for thoracolumbar. Flexion 40 degrees with pain in the right calf.
Flexion 40 degrees, pain in the right calf. Okay.
Extension 10 degrees, pain in the right calf.
Extension 10 degrees, pain in the right calf. Okay.
Side bending to the right, 10 degrees, pain in the right calf.
Okay.
Side bending to the left, 30 degrees, nothing else.
Okay.
Rotation to the right, 10 degrees with abnormal muscle / muscle guarding.
Okay, what about the left?
10 degrees, abnormal muscle and muscle guarding.
Okay, and you said flexion was 40 degrees
Correct.
with pain
In the right calf.
And then extension was 10 degrees.
Yep.
Pain in the right calf.
Correct.
Okay, sounds good. I'm going to move on to the neuromuscular portion of this exam. So what I'm going to do is I'm going to do the slump test to start off.
Okay.
So I'm going to be over here. So I'm going to have you, I'm just going to kind of show you what I want you to do. And I'll be here with you as well. So you're going to be sitting on the edge of the table like this. You're going to have kind of like a slumped posture like that. Okay. And I'm going to have you raise, I'm going to raise your leg.
Okay.
Okay. And then I'm going to have you kind of bend down, and I'll provide some overpressure as well, and be doing some movements to your ankle. Okay. So again, I'm going to have you slump down. Good. I'm going to have you kick your leg out. Perfect. Hold this up. I'm going to have you put your head down. Put some overpressure. All right. And I'm also, as we're doing that, I'm also going to move your ankle, so up and in for peroneal nerve, then reflection, inversion, and then dorsiflexion, eversion. Okay, so let me just remember that again. Do this again. Sorry. So this is, so peroneal is plantar flexion and inversion for peroneal nerve, then dip. TED, I'm sorry, is dorsiflexion and eversion. And then dip is dorsiflexion and dorsiflexion and inversion. Gosh, I gotta go over those. TED, hip. I gotta go over those. Anyways, so I'm gonna have you lay down on your back now. So I'll perform bilaterally, that slump test. And then I'm going to raise your leg up here. So I'm going to perform on the opposite side. So you're feeling on the right. I'm going to do it on the left. And lift your leg up. See if there's any pain into your hamstring, into your back, or into your calf. I'll be measuring hip flexion at this point. See if there's any symptoms. So patient has gotten to 90 degrees without any symptoms, so that's normal. Perform on the right side. So if the patient had symptoms right here, I would document that. I'd also measure hip flexion. We could also do modified, or bring the hip to 90 degrees, and then extend the knee this way. Again, I can do the hip, TED. Another one I can't remember. Dip. Whatever. Okay, Okay, so that's neurological. So that's the straight leg raise, and okay, so I'm also going to perform a cross straight leg raise. So for this one, you have symptoms on your right side. I'm going to lift up your left leg again. So if you had symptoms in your right leg when I did this, that would be indicative of a positive test for cross straight leg raise for disc herniation. Okay. Let's say for neurovascular assessment.
Diminished sensation in the right lateral calf.
Oh, you know, I still gotta do another thing. Need you to sit up, please? On the edge of the table. Okay, so what I need you to do is I want you to lift your left leg up. Okay, and provide some pressure to that. Okay, so then I want you to bring it down. Maybe kick out your leg again. Good. And then, so that's L1, 2, that's L3, L4. So I'm gonna have you bring your toe up. Good. It's L4, L5. So I'm gonna have you I'm gonna push some pressure on your big toe. Keep it up for me. Okay. It's L5. S1 is pushing my finger there, and also pushing my hand. Good. And for S2, I'm gonna have you bring your bend your knee, so trying to push into my hand. Good. So I perform that bilaterally to see if you're strong, see which derm or myotome is affected, if at all, on the right side in comparison to the left. And I'm going to do dermatome testing on your legs as well. So close your eyes. Does the left feel the same on the right? Does the left and the right feel the same like that? This is L1, L2. Medial knee is L3. That feels the same. Medial calf, L4. Then L5, lateral calf. Then S1 is lateral foot. Okay, that completes my, hold on, not done yet. I want to do reflex testing. So L3, L4 is the quadriceps tendon. So I do that on the quadriceps tendon on the left. Also on the right, see if it's hypo or hyper reflexive on both sides. Then I would do the Achilles tendon on both sides. Then I would do a clonus test. So I would quickly dorsiflex the foot on both sides, see if there's any clonus. Then I would bring this up, and with my reflex hammer, I will go up and across for the Babinski. So a positive test would if the feet were to splay, negative test for if the toes were to go down. Do it again on this side, boom, across. Again, positive would be splaying and up an extension, negative would be flexing the toes. Can you please tell me my name?
Diminished sensation in the right lateral calf region.
Right lateral calf, okay.
Normal reflexes.
Sorry, say it again?
Normal reflexes.
Okay.
3 minus out of 5 strength. Right EHL.
Okay, get there. Okay, so you said lateral calf is
Diminished sensation, right lateral calf.
okay.
Normal reflexes.
Okay.
3 minus out of 5 strength. Right EHL.
Alright, so that's L5 extensor hallucis longus, and then L5 lateral calf. Okay, so it's just those findings.
Uh-huh.
Reflexes are fine.
Babinski and clonus. reflexes were normal as well.
Okay. So that is also helpful. So I've done structural inspection, active range of motion, and neurovascular. Okay, now PIVMs. So what I'm going to do, PIVMs, is I'm going to have you face this direction. Lay on your side right here. I'm gonna have you scooch closer to me. I get a pillow for in between us. Okay, so I'm just gonna roll up your shirt if you don't mind. Okay. So I'm going to do PIVMs for flexion right now. So I'm gonna find T12, just right about here. So I'm gonna approximate T12L1 right now. So I'm going to grab the superior leg, put it on my hip ASIS. So I'm at T12L1. So I'm gonna go into flexion. So I'm feeling interspinous space for T12L1, L1, L2, L3, L2, L3, L3, L4, L4, L5, L5, S1. So I can confirm it's L5, S1 by taking the patient's leg into extension. Feeling L5 going into my, or L4 going into my hand. I'm sorry, L5 going into my hand. Good. So then I'm going to just come right back up to T12L1. So I'm at L5S1 right now. L4, L5, L3, L4, L2, L3, L1, L2, T12, L1. Okay, perfect. Now, so that's for flexion and extension. Then I'm going to test a abduction. So I'm going to do this. I'm going to have you lay on this pillow on your stomach. Put your face through there if you want. Okay. So for this, I'm going to test the left and right side. So I'm going to test for side bending. So find T12, approximately T12L1 right here. I'm going to flex the knee to 90. Get underneath the knee. Again, T12L1. Go up there. I'm going to feel the interspinous space. Feel it go in. Absolutely. Feel the interspinous space go pinching and decreasing on the ipsilateral side or opening up on the contralateral side. So at T12L1, down, L1, L2, 2, L3, L3, L4, L4, L5, L5, S1. Confirm it is L5, S1 by going like this. Yep, L5 is appearing. Okay, so then I'm going to go do it on the contralateral side. So for side bending to the left now, find T12 at the rib cage, bottom of the 12th rib, and approximately T12L1 right now. Go into abduction, T12L1, T-L1, L2, L2, L3, 3, L4, L5, firm. Going into extension. Feeling L5 go away into my hand. Good, so that's flexion, extension. Side bending to the left, side bending to the right. How do I want to do rotation? Let's do rotation this way. So I'm going to have you flex the knees. And then I'm going to palpate the interspinous space again. So T12, L1 is approximately right here. So with the rule of the legs, whichever way the legs go is the way of rotation. So if I bring their legs to the patient's right, it is right rotation. So I'm going to feel the interspinous space here. So T12, L1, right rotation. L1, L2, L2, L3, L3, L4, L4, L5, L5S1. Perfect. Now I'm going to work my way up by going and assessing left rotation. So L5S1, L4, L5, L3, L4, L2, L3, L1, L2, T12, L1. Perfecto. So that's flexion, extension, rotation to the left, rotation to the right, side bending to the left, and side bending to the right. So that's all PIVMs. Perfect. So what are the findings for PIVM, please?
Generally limited with forward bending, side bending, rotation of lumbar spine segments.
Okay. General limited with forward bending, you said?
Side bending and rotation of lumbar spine segments.
Sorry, I'm just trying to write this down. Okay, so there's not one area, not one specific segment, it's just generally?
Generally limited.
Okay, forward bending. Sorry, I'm going to ask that one more time. Forward bending is one of them. The second one is what?
Side bending?
Side bending bilaterally.
It just says side bending.
Okay.
And rotation.
Okay, so it's just generally limited pretty much everywhere here.
Mm-hmm.
Generally limited in the lumbar spine. For forward bending, side bending, and rotation. Okay. So at this point, my